What?
Wednesday, baby.
You promised me a couple of episodes ago to announce my name as well, but I will. Somebody, Steve Seuntjens requested that specifically of you.
Right. It's a little different ring. The Eugene B.
Yeah, that's good enough. That's good enough. What's new? How's US treating you still?
Good. Yeah, I'm in Charleston right now, South Carolina. Yeah,
wow.
Yeah. Just a bit of business. It's kind of like normal over here now.
I was gonna say, so today I went to visit our friends at Almirall, Francesca, and everybody has to wear masks, right?
Right.
Everywhere.
Right.
But it actually felt good to be out. I kind of dressed up and changed out of my sweatshirt, and I'm kind of like, I took a gum pack with me, and then I'm like, why do I have gum? I don't need it. I have a mask.
Yeah, that's right. Yeah. It's only you.
Anyway.
Yeah.
But I know we sort of leave it to our friends Jess and Balti Boy to give some investment news. But this one actually just astounded me. I don't know if you know the company Doximity, right? They're physician tools or whatever. And to me, the dumbfounding part is that I'm reading this. It's a press release. Doximity announces confidential submission of draft registration for an IPO for S1. But why do a press release for a confidential submission? I don't know. Anyway,
I think it's like a technical thing. It's meaning that they're the details of the report, or it may be some technical thing, but it's a bit of a it's not proper use of English language. Maybe.
No, it just sounds pretty funny, but
and that other one, that other one's amazing. The better SPAC, is it? The better SPAC was kind of pre-revenue one that they
yeah, we didn't. That's right. It's also fresh. So Better Therapeutics. Yeah, I mean, I started a whole discussion on Twitter on it. Like to me, again, as I tweeted, like, to me, there's it's awesome to have the transparency, but like at the same time, you're basically still in research mode, and I would sort of then start questioning, like, are there not enough VCs that believe in that? And then what makes you think? I don't know. I'm struggling with that one, and to be frank, I also not sure if that's great for the rest of the DTX industry, right? I don't know.
No, I feel good about it. I feel like it's one of those things where people are trying. There's obviously capital available, and there people are trying new kind of modalities. So this is the classic biotech model of, hey, we're going to build a product in a certain area, and so those are always funded in a pre-revenue, and then it's based on the science, it's based on the caliber of the team, it's maybe on some IP. So I think it's good that money's going into that, and that it's kind of running towards it. It would feel like a bit of risk capital, going into it from that standpoint. To your point, like a biotech.
Yeah, and again, right, the pathway, and I didn't see, but I saw a bunch of other people do it. Like the pathway to revenue, sort of this, well, somebody will reimburse it, great, but there's a roadway. So. Anyway, listen, our guest is anxiously waiting. And, speaking of like deals and all of this, I was super excited to reconnect with her after many years as I'm sitting on the terrace. And I'm going to let her in.
Fantastic.
Meghan FitzGerald. And I will tell you and probably her a little bit of a secret once she gets in here.
Okay.
Hey there.
Hey,
there she is.
Nice to meet you, Meghan.
Meghan
and Klaus.
Jim and Klaus.
Jim,
hello,
nice
Klaus.
to see you.
I love.
And
what's?
You heard it was a digital show. It's his favorite show. He had to do a drive-by.
This is awesome. Our second dog on the show. This is amazing.
Right.
Oh, really? See, I didn't know that. This might be the largest dog, though.
Yeah, I think so.
So before you do your own introduction, Meghan, I was just telling Jim, so we record a minute or two before we let our guest in. I don't think many people know that the reason that Jim and I actually know each other, or the reason I'm even in Europe, is you know, a good portion of that is due to you, because I still remember the day when, you know, you and I were at Metco together, and you were sort of the championing of Europa Epithic Venlo in the acquisition. And I remember walking into your office, kind of like peeking in. You had no idea who I am. I knew who you are. And so you're gonna need like a CIO over there, right? And so, you know, we've sort of navigated all of that, and you know, Metco brought me over to the side of the pond. So the reason Jim and I are friends is because of you. There you go.
That's amazing. I'm the Kevin Bacon of Eugene's life.
The Kevin
That's
Bacon.
awesome. Isn't that crazy though? I worked at Merck when Merck owned Medco, and I remember thinking, no, I don't want to go over and work in a managed care division. And then eventually, you know, they separate, and I work at Medco, and then Eugene comes in. I'm like, CTO, CIO, like, why do we even need that? Way ahead of it. Way ahead of it. It was decades before there was even like every company had a CTO and its, you know, executive committee.
Right.
Eugene was all in healthcare.
Yeah.
So, but for our millions of listeners and viewers, I mean, I know you. You just met Jim, but maybe, and I'll sort of peek this a little bit. But I loved it. I actually just started reading it yesterday. Even though I got it a while back, but I love the title.
The coloring book. It'll take you.
Ascending Davos, a career journey from emergency room to the boardroom. So. Maybe not in a book thing, but like in 60 seconds or 2 minutes or something. Give us a little bit of your background.
Yeah, so I started work in an emergency room, and then went to work on the Tohono O'odham Indian Reservation, almost south of the border in Nogales, Arizona. And then, you know, got into corporate America, Merck, Pfizer, then Medco, then Cardinal, on the board of Tenet. So I've done almost the whole 18% of GDP. There's a few of us that, you know, can't keep a job. But the one thread I've kind of missed that runs, you know, through my whole career is obviously what you guys are deep in, and that's, you know, digital and tech. So I, you know, have such an appreciation for the show. I think a big part of what I like to do too is I love academics. I teach at Columbia. I teach at City University of New York. Ironically, I, you know, got a PhD in public health and epidemiology, focused on the socio-determinants of health before it was even something anyone wanted to talk about. And that's kind of always been my beacon and, you know, guiding light, is to do well by patients and stay close to the patients. And it's, you know, made me probably a better person, and certainly a better deal maker, because at the end of the day, if you're not doing something for a patient, you're probably not going to be successful. What
made you leave the emergency room? And you were in nursing, or not only? Okay, just
I was an EMT, and then I was a nurse. I remember, you know, making a spreadsheet about a job that was like $22,000 a year or $26,000 a year if I wanted to work down on the reservation. And I'm like, oh, I'm going to take the $26,000 a year job. And then I realized it was like a 2-hour commute each way. So suddenly it wasn't more money. It was all in gas and, you know, battle pay. I really felt like there was more that I wanted to do at the population level. And it's a high burnout. You know, you would come home and somebody in your family would say they're not feeling well, and you'd be like, please, you didn't flip a car, or, you know, you're not a hurt child. It really is very, very tough. I can only imagine in a time of COVID what it was like for all the first responders, and probably a lot like what happened after 9/11 with the first responders. They're going to be suffering for years to come, because you're just on the whole time. You're on for 14 hours. So when someone says, hey, I can't wear a mask, it's like, well, try wearing a mask and booties and a hat and all kinds of gear for 14 hours, you know, saving lives. So it was really high burnout. I felt like there's more I wanted to do. You know, it was probably the best degree I ever got, because I had such an appreciation for patients, but I felt like I like to build things and put things together, which is what led me to, you know, strategy ultimately. So I didn't do it very long, went back, you know, got an MBA, eventually got an MPH, eventually got a doctorate, and just kind of kept going to school and adding to my portfolio. But also, you know, you work really hard. And I don't know that you get appreciated as much. I read recently, like you could manage Chipotle and make more than you could even as a nurse practitioner. Not to take away from anybody managing Chipotle, but kind of think about that. It puts it into perspective.
Right. And what we got to touch on the reservation. What was the big takeaway from working on the reservation? That you remember it?
Oh God, vividly. And I remember no cell phone service worked down there. You passed all the telescopes because it's like the most beautiful sky in the world. I remember one night having to slam on the brakes because we saw 4 little legs in the road and I thought they were little children, and we hit a cactus, me and a patient care tech that I was commuting with. And then I'm like, oh my gosh, are you okay? And once we figured out we were okay, I said, thank God, hopefully the kids are okay. And we looked out the window and it was this enormous cow that was like, the 4 legs were cow legs that looked like children in the car. But what I learned is work on an Indian reservation is so rewarding, and you realize how much more we owe indigenous people and how much they've been left behind. And, thinking that you just drop off food or you do a little bit here, there's a higher incidence of suicide with younger people on the reservation. Diabetes is really prevalent, and, they need a lot of support and help. And I don't know that we always understand that. Many of the patients' children went on to be nurses and doctors, and years later I would see them there back on the reservation taking care of their own, which was amazing. By the way, there was really no border wall there. That was a big irony to me. You could just walk across. There'd be coyotes walking across. I went to lunch in Mexico. You could come back. It really was very free, and those on the Tohono O'odham reservation believed that. They didn't believe in walls and like preventing people from coming out. So I read with great interest, a lot what's going on with immigration and the debate, because we would see people walk days to cross, and it's 120-degree heat down there, and it was intense. And so you have an appreciation that if you've walked for 4 days, it must be for good reason. So I honestly got almost all of my inspiration to work in population health and to help people have better lives from that time on the reservation, Jim. So I'm glad you asked me about it. A lot of people don't. It literally was like, going into the military. It was just a surreal place to work at a very surreal time.
Right, that's awesome.
And I'm sure you talked to a certain extent to it in the book. I'm curious. I think you've seen this, and I'm desperately trying, not desperately, but trying to write mine. And what was the sort of the motivation to write the book, and a little bit of the process you took? So I'm taking hints from you now, as I did back 10, 12 years ago.
Oh my gosh, I feel like you could do this in a snap, and I should be following you. So I'm really lucky that I teach a class called The Business of Healthcare at Columbia. I've been teaching it now for 7 years, and we walk the students through the Fortune 500 of all payers, providers, how the whole 18% of GDP moves. And teaching that class required a syllabus and reading. And there really wasn't a lot on the business of healthcare, how all the capital flows, all the players. A lot of people still don't even know what a PBM is, Eugene. I mean, that, my mom, when I went to Cardinal, she's like, oh, it competes with Medco. And I'm like, no, that's a distributor. You tell people in Europe about our healthcare system and they're like, what is that? So it was a fascinating class to teach and bring to life, but it made me realize, instead of making a new syllabus every year, why don't I write a book? And it lays out the class, but also lays out my journey. Because if anyone could rise and have a career, I was like an unlikely story. I wasn't like necessarily an overachiever. And so I feel like if I could do it, anybody could do it. So not only do I take you through, all the sectors of healthcare, I take you kind of through my journey and how I made career pivots and what I really value, and trials and tribulations of ascending the ladder, which you both know really well. And a lot of people appreciate the story. And really the punchline of the whole book is that health is a form of wealth. You get caught up in your title, how much you're making, and then suddenly 2 years in a job, you're like, wow, why am I commuting every weekend to my job? And why am I going to work in the dark and coming home in the dark? And gosh, I've been working for a toxic boss for 2 years and I have migraines. You don't think about your health until you're in the middle of it, and then you can't orchestrate an off ramp. You're stressed, you're trying to find the next job. So I think if we taught people up front, pay package good, title good, always negotiate, but ask yourself, is this a healthy job for you? Is it a healthy sector? Are you doing something that is making you, better? Or is it really a negative on your health? And do you work for a healthy company? I'm sure you guys have been in places before where you're like, a lot of people look really unhappy here. That's a signal, that's a cue. So I really hope that that's what everyone, got out of the book, is don't wait too long to realize that at the end of the day, you get one run on this planet, and make it count, and you might as well be safe.
So it's a whole mapping. It's your own mapping of the healthcare system and how you went through it, and that's phenomenal. That's phenomenal. I'm definitely
how I pick jobs, how I value things, and I don't know. My husband's like, it's a little Machiavellian. Like I didn't really realize. I saw corporate America, it's a big game. Like you can be a good corporate. I really have always enjoyed navigating corporate America. Eugene's really good at it too, but some people are good at it. Some people are not. And sometimes people maybe shouldn't be promoted, but they navigated the system better. And, you find work on things.
Was it Machiavelli? Wasn't he, courting Spanish kings there now with you in Barcelona with Eugene?
That's right. That's right. I was actually, so today, by the way, I chose to drink this Dutch old fashioned in kind of celebration of Meghan, setting up the job for this thing and me moving to Amsterdam. Yeah. And actually today we finally got, it's called the Spanish niece, so like the full sort of residency status here, because we were on a visa. So I'm just drinking, guys. That's it. I'm happy.
I love it.
I'm on a coffee.
Yeah, I've got a Diet Sprite. This is why you have a hot show. This is the hot show, by the way. I saw the interview with Therapeutics. How fascinating. That was such a good interview you guys put on. That went pretty viral.
With Corey, the DTX one. Yeah. That's my, really this is where I'm cheating on Jim Joyce. That's a separate podcast, Megan. So just FYI. But yes, that was...
I'm just the spying partner. We just try to keep them fresh every week, kind of duke them out, meet them.
Eugene is like one of those network stars. He moonlights on 60 Minutes. He has his own show. They pipe him in the morning. He's kind of a guy that has all these different things going on.
If Marina actually watches this, she'll be like, your head is gonna blow up or something, to me.
She knows what she married, and you married up. So I think
that is true.
But, I love the whole Machiavellian aspect.
I know this is bad now. I gave my secret away. You can read it and think.
I'm someone who, I would say I just spent ever since the situation that we're in globally here came in, I've started getting into playlists. So I have the, a pandemic playlist, but I also have a playlist that when I enter the house, I have an entrance playlist. So the music goes on the Alexa, as I walk into the house every night when I come in.
So what is a home entry walk-in song? Because I love UFC and MMA, and everyone's got their walkout song. I've never heard that there could be
it's epic.
Jim Joyce.
Are you gonna play one for us now?
Yeah,
it's epic. The first one, the first one, it's it's a Tom Jones song. It's Sex Bomb, Sex Bomb. But we'll go right out of that. And it's then we
go to number two, man. Go to number two.
No, it's number two.
Quick, before I get canceled. Getting jiggy with it. And then
Eugene, then what? So you got getting jiggy, that's acceptable. So I see a theme going on when you enter your house, by the way.
Yeah, who let the dogs out? And then we go.
That's a good one. Yeah.
So I was asked, I forget which conference it is, they wanted to play some song, and this was Beastie Boys? Am I hearing Right to Party? Yes.
I like it. That's going on the list.
Are you guys? Oh, that's it. Are you guys impressed that I heard that it was Beastie Boys, even though you couldn't even hear it?
You got it in one tune.
Yeah.
You got that in one. You literally, I think it was like one beat. You got that. That's impressive.
Proper Brooklyn boy there.
I was asked also, like, it was some conference in Belgium, and I chose Be Nice. Have you heard the
nice.
Be Nice Black Eyed Peas? It's a good
I
song.
like that.
I'm not going to try singing, but you know what? We should get Marty and Ritesh on to just, you know, they've been going, you know, the digital health DJs, but
This is how you know Eugene's taking it up a notch. He's now like Ellen. He's going to have like a DJ crew off to the side. They'll be walking. Out
right.
But back to you, Meg. Back to you. All right. So you went to Cardinal, but then now are you doing private equity stuff? And I know you've sort of been in and around venture capital. Like, how are you looking at a lot of this from a money flow perspective? Private equity, which squeezes, right? But also gives opportunity to pull assets together for better efficiency. I'll pause here because I'm not in private equity, but maybe talk a little bit about your time there and what you're doing.
Yeah. So I've been in private equity now almost 4 years. When I left corporate America, I really wanted to work in the field of investing. I felt like I, you know, ran M&A at Cardinal. I did M&A and strategy at Medco. I did strategy at Pfizer. It seems like wherever I went, no matter how hard I tried to be an operator, they're like, and you're going to do strategy. I was like, okay, here I go again. So when I left corporate America, I'm like, wow, I would love to do private equity. I love to build things. I love to put things together. You know, being around for so long, I had a pretty good Rolodex, so I could always connect to people with ideas. And, you know, you find that capital sometimes can be the commodity. To really do well in healthcare, it's capital, content, and connections. All three tend to be the winning formula. And I felt like I could bring a lot of alpha around things that weren't, you know, necessarily capital. But nobody wanted to hire me when I got out of the Fortune 500. They said, oh, you weren't a banker. I was like, what? I did like 100 deals. Like, I don't understand, you know? And so I said, well, what if I worked for free and learned something? So I followed 2 people around for a year that let me, you know, be near them and learn and apprentice from them. And so I remember telling my husband, you know, I'm going to take a year off. It's like going back to school. A friend of mine at Lazard set up a debt workshop. I went and learned everything about debt, even though it turns out I did not want to financially engineer. I wanted to grow things, which is more venture. And it's ironic, venture and private equity is kind of meeting in the middle now, where there's this like massive amount of growth capital. So I spent the year learning, reading and studying and getting close to people. And I knew eventually I would break in. And then every month I picked something fun to do. I went to Coachella. I jumped out of an airplane with my mom over Dubai, and it just kind of kept going on. And my husband was like, what happened to the job? And I was like, oh, I'm working on it. And he's like, not really. Like we're in Morocco and we're here. And I was like, okay, this is what, isn't this what Bill Gates does? He, goes to a cabin and thinks about things. So I thought like maybe I could do that. But I eventually was a reference for somebody who got a job in private equity. And I remember I was surfing and it was really hot on the sand. And I wanted to be the reference really fast, but I wanted to get on with my day. I was also really jealous. Like, this person's getting into private equity and I've been trying out for free. I was like so aggravated by it, but I was a good reference. That's what you do for good people. And it boomeranged right back to me, the law of abundance. I give to people and the world comes back to you better. And that person called me and said, hey, listen, there's a family office. They're looking for someone that is more patient with capital, more strategic, not looking to flip things so fast. They want to grow ideas and have a thesis, and they want to put $5 billion to work. And I was like, really? Wow, that's like amazing. And I interviewed and I got the job and I was off to the races. The first deal we did was Parexel. It was like one of the largest take privates that year. It was a CRO that needed a lot of digital help, needed a lot of, ideas for strategy. It was an amazing company with an amazing founder and team. And then the next one is we built something called K2 Health Ventures, which provides venture capital and debt to life sciences. And then the last deal I did was animal health. You're going to think that's biased, but cash pay, no Medicare. You now know why people love animal health. There's a big push in digital for animal health. You want to track the dog, own the dog. There's a lot of economics if you can constantly be talking to a patient that can't talk back and its owner will pay anything to help the dog feel better. So that's what I did. And then after we spent the $5 billion, I said, hey, I'd love to do more deal making in the US. And I got really lucky. I got picked up by Goldman Sachs to be an advisor and have been there for, the last 9 months. And I absolutely love it. And they allow me to teach. I sit on the board of Tenet. And then I put my own money to work in small deals. I put some money into Mindbloom, which is psychedelics for depression, ketamine, an amazing business model. I was an investor in HIMS, which I love. I thought that was a genius model, and that was before COVID. And I've always loved telehealth. I've always thought that leverages the talent, right? You don't need a doctor and a nurse all the time. If there's something telehealth or a tech can do, you want to offload those things that are of lower value to assets or technology that can make people better. And so I have this great, symbiotic set of activities that feed off each other. I learned so much from teaching, right? Because, half the people in the class want to be entrepreneurs and they're changing the world. Literally, like 22-year-olds are changing the world. I was lifeguarding then. And so it's amazing.
Do you ever get stumped by a question from the students? Like, holy shit, I haven't looked at it, or I haven't thought about it that way. Like, I'm actually kind of curious, because I get stumped all the time, like mentees and stuff like that, which is great. I love it. That's why.
All the time, especially on AI and Bitcoin and coding. And, if I could go back again, that, I would have majored probably in computer science and a side of math, right? That's what you would tell everybody. It just, I'm always so stumped and interested by it. And
you got to study up on NFTs, Megan.
Oh, I know.
Come on, that's going to be in the next week's question to you from your students.
I'm on it. I think when we played Jim's walk-in song, that actually could go for
right.
That's going to be the hot health NFT.
So
listen,
Megan,
my older one is buying Bitcoins. Literally,
That's
like
awesome.
This morning, she was like telling me that she's buying Bitcoins.
I find kids, I say kids, young adults, absolutely fascinating. Like, we were just interviewing for a position at Health Beacon the other day, and we just sat back and just they're the way they think about the world, the way they connect the dots on things, the way they kind of, they're so much more well-rounded than I ever was. It was just chasing, but yeah, it was the 26 grand versus the 22 grand. It was like very clear, it was, status or power or money or whatever. And they come in with this real sense of the world. What do you think is going on right now? Like, what's your take on these new, like, we started the podcast before you came in, just talking about better health and talking about, just the frenetic activity. I'm a bull on it. That's I think, Eugene, you're somewhere in between in terms of the capital.
Why did you plant the seed right away? It was a leading question, Jim.
Yeah, no, but I wanted to.
We talked just earlier, better therapeutics that is SPACing out with no revenues and not even an approved product yet, right? Then we have Doximity, just again, a billion a week going into digital health, roughly, right? So I just wanted to expand on it, Jim. I'm sorry, like in numbers. So back to you, Miss FitzGerald.
Yeah. So sorry, you guys I feel like you answered your own questions.
No, just your opinion. We threw out our opinions. We tend to do that, but what's your take on what's going on? How are you feeling about the investment climate? Where are you seeing the action? Does it make sense to you?
Oh yeah. So, gosh, that's such a good question. So one, I think there's tons of capital. And I'm married to an economist who, reminds me he's got inflation indicators. So right now, like, things are great, right? We're definitely in an upswing, and everyone feels it. It feels a little bit euphoric, and it feels like there's more capital than there's ideas. And so things are trading, for intense and enormous prices. I like a few areas. I love pharma services. It's not just because of COVID, which I think has been, wind at the back of pharma, but I think there's been like real innovation in oncology and cell therapy. And, Eugene, when we were at Medco, we really didn't talk about cure. And now you can talk about cure. And for many cancers, you can talk about it as being a chronic disease. So I love pharma and all the services that go around it. And we realized this, right, when the vaccine got done. You got a vaccine done in a year, and then it's like, wow, this logistics is really hard. This distribution is really hard. A plant is really hard, and we're mixing up vaccines, and now we have to throw 15 million away because we didn't have capacity. And I think a lot of people were not aware of the channel, which is what we were so used to at Medco. So I love pharma. I love the channel. I love all things having to do with care in the home and putting people in the most optimal setting to make them happy and healthy, and then knowing to put them in the right setting if it's an acute problem. Same with the physicians, same with the nurses. You should be tailoring what you need based on setting, the person seeing you, the medication, and the protocol. And I think we're getting better at that. We're getting more predictive. And therefore, digital and tech runs through it. You know, if you look at healthcare, it's really an industrial, tech, and financial problem. Like, it almost wouldn't be its own sector. You would just say, okay, it really breaks down in those three areas. And I think, you know, COVID really teleported telehealth by 5 years because, you know, Medicare decided to reimburse it. They decided to, you know, get rid of some of the regulatory bureaucracy. That's always been the problem with it. So I think now it sticks, because now the real benefit is being, you know, shining through. And that is, you know, that it's just so incredibly valuable and effective at scaling what you do. Now, I think what's going to be interesting is to see who puts things together, like Livongo. Will there be one for oncology? Will there be one for something else? I think it's all the wrappers that go around, you know, the digital product, if you will, or the telehealth product, that we're going to go a lot deeper with AI and what we can do. And I think that'll be, I think that's what I'm really interested about. A lot more VC money there, because a lot of them take a lot of money to warrant a private equity check, but a lot of energy.
If you look out, let's say 5 years, like if you look out, like, do you see like if you were to bet on it, would you see like a few key players, you know, like, you know, you got like an Amazon playing in health with like a Teladoc, or what do you think the landscape will look like? Because it seems like a lot of the products feel like each other, you know, like chronic disease management, behavioral management, you know, and they're coming at it from, or will it be as fragmented as it's like?
I think it's going to be fragmented for a long time. I think all the traditional players will consolidate first. 3 PBMs, 3 distributors, 3 payers. There'll be 3 CROs, 4 CROs. Everyone that is like a major player now that makes up the Fortune 500 will look totally different in 5 years. And then there's all the incumbents. There's all the people, you know, whether it's Best Buy, Amazon, Apple, people buying Fitbit or Whoops, or all the data and all the things that go along with monitoring the data. That to me is like the next gen of the Fortune 500. And they start to sift out all the incumbents, and they start becoming the players, or they start buying things. It's ironic to me. Amazon can buy any healthcare company in the Fortune 500 it wants, wouldn't even miss a beat. Could buy a distributor, could buy a PBM, could totally vertically integrate if it wanted to, and it's choosing to take.
But they don't want to buy the mess. They don't want to buy the mess with it. They'd rather build it from somewhat of a scratch, right? And we're starting to see some of the moves. And what is it? I mean, you mentioned, you know, Amazon, but like, we shouldn't underestimate Microsoft, right? I mean, the new the Nuance acquisition, and then this morning I watched they did a huge deal with AXA now, right?
Yeah.
So
yeah,
I think,
and they hardly ever deal make. And forever I was told Apple and Microsoft will never take a vertical in healthcare. That's not what we do. And that's exactly what they're doing. But the time is right for them. When you say that, it wasn't really right 5 years ago. Now it's perfectly timed with telehealth and AI and data and predictive analytics. And we're now, you know, approving drugs off, you know, phase 2 data. We've just gotten better. So I feel like it's their time. And I think there's just going to be a flurry of activity, and it's going to take a while before we can call it and say, yeah, these are the 5 new players. I think it's going to be a little while. I think there's going to be a lot of players, and it's going to be really exciting.
Just adding in, like even Google, right? This week or last week, I can't keep track of all these announcements, sort of relaunching, for lack of a better term, not the full Google Health, but like, you know, Missy Krasner, Ronnie Ziegler, who were like in that first generation of the Google Health. It's, you know, it's all timing. And, you know, it's interesting because your sort of predictions on, or the love, or I'll call it the Meghan FitzGerald thesis, right? Of pharma and care at home. And you mentioned yourself, you invested into Hims, right? So where's in your thesis the consumer, right? Because I mean, this is sort of coming at it not from within the healthcare system, but from a consumer perspective. And then the two worlds are starting to merge, right? A bit. Where your head is?
Yeah, I think the one you can look at is I was early in Gelisys, which launched Plenity, which is a weight loss product, did a partnership with Roe. They did a telehealth wrapper, this idea that I'm talking about where you have product service wrapped around a digital, if you will, wrapper, and then you're able to target the patients. And I think that's fascinating because they went direct to patient. They figured out what the price point was because they said, even if we had gone to, a PBM and they still may have, the copay might have been what the cash pay was for the consumer. And I think the consumer appreciates that it's transparent. I know what value I'm getting from Jim and Eugene, and I'm willing to pay for that value in return, and you're helping me lose weight, live a better life. So that's one I look after. I went into Gelisys because obesity was just so hard to ignore. So I find that my personal investments, nobody ever wants to hear this, but I feel like I'm a public health capitalist. If it's, I was on the board of Senior Link, we had an exit this year, Gelisys, mental health, HIMSS. There's a thread to what I like to invest in, which ties to what I am at my heart. And that is somebody that roots for the patient. So I don't see them as a consumer. I see them as a patient because they're at a vulnerable point where information is asymmetrical. They want to be trusted. They're not buying Bitcoin. They're not making a trade. You're getting them when times are tough and they're making a really personal and serious decision. And so I never forget that they're the patient. It's just digital helps to reach them. It's a mode of reaching the patient that is really personal. It's discreet. It's quick. With COVID now, everything gets door dashed. If it takes more than 10 minutes, I'm like, what do you mean? What do you mean it takes 12 minutes? Yeah. We've conditioned everybody that you want it fast. So I think the consumer fits in as a patient. And I also think they're willing to now pay and allocate money, and payers are pushing more to them. I think they're becoming a lot more sophisticated, but we could never forget that they still need the human interaction. And I think the companies that figure out the ratio of human to tech wins. So if you don't need a surgeon, don't use a surgeon. Use this, use this with tech. In the home, a caregiver plus tech, perfect combination. You can't put an 80-year-old in an Uber. They still need somebody. They still need empathy. They still need someone, to be with them. So I don't think there's ever going to be, a robot in the home, but I think half the equation could be handled by tech and digital.
I mean, look, Jim is the perfect example of my mental health partner, right?
I thought you were going to say
we're using
robot.
technology. No.
It's really not Jim. I knew it. This is what you're going to do to me. This is the joke of the show. He's an avatar.
Right. An avatar. I think we'd probably edit it a little bit.
We've actually done that episode already with Avatar.
Oh, yeah.
Yeah.
But what do you think? I mean, you do this every day. Talk about asking me something that I don't know nearly as much about as you two. What do you both think? Are you more bullish than me? Are you about the same?
I think I like the way you describe it. A couple of things fascinated me right now is, like we're calling you, I'm in South Carolina right now, but I'm usually in Dublin, Ireland, and Eugene's in Barcelona, is I'm fascinated by that healthcare companies, only really pharmaceutical companies globalized in the past. When you saw efforts from companies that you work for, you guys tried to set up Medco, you tried to do this, and it didn't work. It was so unusual. So I'm fascinated that digital might start to create global giants in a way that it couldn't happen in other healthcare systems. So I think that's a really, that for me, that's kind of interesting. And at the same time, we have this nationalization that's happening inside there. So I think that's one element. And then the other side is just, I think you brought it up too, this idea that, cancer becomes a chronic condition. We had on, food as medicine as one, we had on our last guest, just that the innovation that's going to happen, all this new kind of tech that's going to, proteins and biologics and all this stuff that's going to come at us, that the system's going to have to evolve to meet it. So I don't know, that's how I'm thinking about, there's a few wild cards, I guess, out there that maybe we can't think about.
I made my book. I always copy people's ideas. I love that idea that digital could follow a path like biopharma, unlike health services has been able to do because of the payers and the sick funds and this and that and all the things Eugene and I had to deal with. Eugene, what about you? What say you? How do you, more bullish than us or what?
I am actually bullish on, and I do call them consumers because ultimately the experience sucks, and the individuals. And the question is, so I'm bullish in the fact that there's a tremendous amount of entrepreneurs that are solving real world problems, no longer just, you know, a tech push, here's a cool toy, right? I think there's enough of experienced entrepreneurs and teams, you know, that are in this market now, that are not just recognizing the problems, but also know how to solve them. I think there's the economies of scale, which that's I think is what you mentioned, Jim. Your prediction is, look, Teladoc is, I don't know in how many countries, right? But to me, Teladoc is the pipes. The question is, how do you get that personal touch for a particular therapeutic area, for a particular disease, and then pull that together? And I think that's where the next frontier is. And I don't think there's enough great targets in all of that from a company perspective to say, what is this holistic experience for that individual? Notice I don't even say consumer, just individual. And I think that will persist. I mean, look, when Livongo went public, I want to say they covered 40,000 lives or something like that at the time, right? Just, again, huge effort, right? Tons of money, went public. I want to say 40,000, but it might be a little bit more, but 300 million people in US, right? So I think the outcomes to the valuations are astounding to me. And the last thing I'll say is, and I know it's slowed down quite a bit in the last month, the whole SPACing out and new SPACs. I know I've heard sort of through the grapevine it's becoming much, much harder now. And I think it's because there's actually not enough targets out there, what I talked about before. And so this whole SPAC, and I think it's going to be a shit show in the next 3 years on this.
Well, I'm involved in one.
I'll shut up.
Yeah, no, it's okay. It's a good debate. I'm involved in a SPAC, and I picked a healthcare tech group who was very focused. I did this with Thimblepoint and Launch Capital because they just have an amazing track record, and we had worked together on Genesis. So I think those that de-SPAC will go on to be serial de-SPACers. They'll be good at it. They know what they want to do. Then there's a whole bunch of people that just got in and are mucking it up and probably won't de-SPAC, aren't good enough to get a management team to sign on with them, aren't earning their promote. You have to earn your promote. You have to tell the company why you're going to do well by them. And I think there'll be carnage there. I agree there'll be carnage, but I think the good ones will be around and rise up, and there'll be quite a few. I don't think it'll go away. It's just another instrument to get, to get money and to get liquidity.
I mean, SPAC's been around, right? They've been around.
Yeah, right.
It just, all of a sudden it's,
it's back.
Yeah.
It's a sign. I think it's just phenomenal because there's so much, like coming back to, there's so much work to do. That capital needs to find faster, more efficient ways to get into the market, to get the tools. And, having, like in my own company, and Eugene has the same experience, like raising capital and trying to explain, remember, when I was starting my Health Beacon up, it was like, it's not a pharma project, it's not a biotech project, right. And it's not a technology, it's kind of somewhere in between. And you have to kind of pretend you care about IP when you're talking to the pharma people, and then you have to pretend you care about user-centered design, over here.
You use words like consumer versus patient. It's so funny. People always say, well, what analyst would cover you? Would it be a pharma analyst? Would it be the tech analyst? Like, right. What is it? And so I think also, this shakeout of the traditional players means there'll also be new analysts. There's new areas and new verticals and sectors to cover. So I think we're at a real renaissance for healthcare.
I think so.
A real change where we're starting to see people call them consumers in some ways, and in some areas they behave like consumers. And then we have new sources of capital and new sources of strategic partners. We also didn't touch on, I'm down here in Florida. You have to redefine what it means to be old. People down here in their 80s, they're wearing skinny jeans and they're rocking it out at the Apple Bar. My mom drives a zipping around in a Fiat. She's in her 70s and she's a caregiver for someone in her 90s. So don't call her old. She's jumping out of a plane. You've got my husband with the Whoop app here, the iWatch here. He wakes up every morning and he goes, I'm only 75% recovered. You must have kicked me last night in bed. I'm like, oh my God, I can't deal with your recovery anymore. Like, what should be your recovery? Where's the data on it? So, you've got to, segment of the market that wants to be their own best Olympic athlete, whatever it is, at whatever age, they're going to perform to the best that their body can perform. And they're going to use all the digital tools to do that. So they're going to drive, I think, adoption with some of the relics in healthcare that are like, well, I don't know, it's HIPAA and blah, blah, blah. There's enough people pushing it now that they're making you want to talk and have it. It just is a bit much to live with someone that, you know, is recording their calories, recording their sleep, and we're walking around talking about, you know, I recovered at 78 versus 76. Do you notice a difference? No, I really don't, you know, so.
You should actually watch one of the early, a couple of episodes ago, we had Zaina Kayat talking about ageism, and she has actually a book that came out on sort of aging and active aging, and just, you know, some stats. I think like 30% of our we ask all of our coaches when they sign up to choose up to 5 categories, and active aging is like the 3rd or the 4th most popular.
Yeah, I'm blown away. I think ageism, aging, you know, how we think about that is also going through this kind of really interesting period. Like my folks are also in Florida, and I'm blown away by their lives. It's like summer camp for old people. You know, it's like it's, they're running around their golf carts.
Yeah, I mean, I can't hang with any of them. I ran the New York Marathon, and they showed all the people from Naples, Florida, and this 78-year-old rocked me by like half time. By like half. I was like, did she only run 13 miles? No, she friggin' cooked it. And so I was like, oh, don't put me in the paper with her, you know, don't even bother. So it's just amazing to me that forget absence of disease. That's what you think of as you age, or we all have 5 chronic conditions at Medicare. There's a desire to be to thrive as much as possible for as long as possible in the settings that matter. And I think, you know, that's why there's funds that are dedicated to aging. There's like actually people that only invest, you know, in aging. I only invest in like public health things. And I hope someday someone else calls me or listens to your show and says, I'm a public health capitalist too. But there's all these sectors of like pockets of money where people are going deep on a thesis. And there's, you know, as Eugene said, there's enough per capitas to do it, right? There's, you know, 350 million per capitas that you try and get. And some people could get 40,000 and have a multi-billion-dollar market cap. It's like a specialty drug, right? So it's kind of mind-blowing.
So Jim, you want to do your?
I'm dying to hear this one.
Here.
So
okay.
So when you, if you're,
like, me, this is like usually you tell a guest something. I got nothing.
Zero.
Nothing. Is that what you guys do?
Yeah, we're like the vampires. We're just
I know.
energy every Wednesday.
Exactly.
That's how we get it.
We seem smiley and charming, but we're just sucking information out.
Very Oprah-like. Yeah, very Oprah-like. I'm saying things I shouldn't, and you know, next time.
No,
but
wiring
money. Yeah.
One of your kids in your class, you know, comes up to you and says, I want to be a digital health entrepreneur and I want to go into it. What kind of advice, what kind of advice would you give him or her?
Gosh, it's so boring what I say, and that's why I'm so bad at this. That's why I was shocked when Eugene called and said, I want you to be on the Digital Health podcast. I'm like, oh my gosh, that's like a dream that somebody would even think I had something to say. Because whenever someone tells me about an idea, I'm always like, what problem are you solving and who's paying for it? So whenever I hear about digital health, it's back to, you know, treating it like an industrial tech or financial problem. And I always find that sometimes the greatest innovation is just not sexy in healthcare. It's like making billing more efficient. Everyone's like, I don't want to do that. That's not a moonshot. I'm like, it's Nobel laureate work. If you fixed billing or administration, you would win everything. So I always say, what are you doing? Because there's so much friction in healthcare, unless you're just going solely consumer, less about the patient and you're going for cash pay. Are you making the system better with less friction? What are you doing? And who wants to pay you for that? That's my advice every single time. But you guys tell me, because this is what you do. What should I say to the student?
I love it. What's the problem and who's going to pay for it? I love it.
But honestly, I mean, we've talked about this even on the Shadow of Digital Health for 4 seasons. It's at the end of the day, the word digital, like even the digital therapeutics, it's just another therapy. It just happens to be digital, right? And at the end of the day, is it going to have outcomes, right? Is it going to help somebody? and how the hell are you going to get paid? So there you go. You don't need to be in digital health, Meghan.
No. And I also think, are you going to remove waste and inefficiency? So with a digital therapeutic, does all children need to be on as much Adderall as they are on? Wouldn't it be great if you started with the digital therapeutic and that intervention, and then you're adding on the drug or adding on the surgery or adding on the other intervention? Look at me holistically. Pay for me holistically. What else do I need? I volunteered during COVID across the street at the hospital, and we had someone on my floor. And I said, wow, she looks really healthy. She's been here a long time. And they said, Meg, she's a resident. I said, a resident? I've been out of the hospital for a while. What's a resident? She said, we can't discharge her because she's homeless. I said, oh my God, she must eat up all the EBITDA of the floor. And they're like, EBITDA, what is that? I'm like, oh, forget it. We must not make any money on this floor. Like, that is a resident. So we weren't solving, we were letting her go out the front door of the hospital to come in through the emergency room and back around. Why? I mean, this is why United Health, decided to go into the real estate business. So I think we're realizing that non-health problems are now health problems. Transportation, what you eat, where you live. You may say, that's not my problem. That's not a healthcare problem. Well, it'll affect your reimbursement then. So maybe it won't affect your revenue, but it's going to affect what you get paid if you don't solve for it. And I think that, to me, is worthy of a lot of activity for those that are in digital and tech.
Awesome.
Love that. Non-health problems are now health problems. That's a great way to end it.
Right? I mean, you can ignore it. I often think, like, if I ran HHS, I'd merge it with some other buckets, like some of the other, fundings of government should be with health because they're related, whether it's like education or urban planning.
Megan, careful now. Joe Biden is going to come calling. After
I have
this
all those
episode
bad
airs.
emails. I have all those bad emails to you. You two would do a show and be like, oh yeah, look at this.
Awesome.
Well, listen, thanks for making the time. It was awesome to reconnect, and we'll, I'm sure, be chatting much more.
I'm so proud of you, Eugene, and Jim. What a great friend to make. And if I get to Ireland or you need me to go visit, let me know. And Eugene, you're just a great person. Just really, it matters. People that you work with matter, and you remember them. And so, here we are 20 years later, you're still just a great person. So thanks for having me on. I'm really honored.
Lovely.